Good morning, everyone, and a very big welcome from AtlanTec Festival team of 2022. We're back again for our 8th year, and we've been running a packed event since Monday. So I hope you've all been able to join us for some of these fantastic sessions and that have taken place so far. We've had 35 events and 40 speakers over the week. We'd love to have you participate today by following us on Twitter @AtlanTecFest and by using the hashtag AtlanTec. And of course, please put as many questions in the Q&A box and we will get to them at the end of the talk. Well, to introduce myself, my name is Fiona Neary and I'm Innovation Operations Manager in NUI Galway, working on various initiatives to develop, scale and grow the startup community on campus and in the region. My role focuses on driving impact for the university by inspiring and progressing research into commercially viable opportunities. And as we all know, Galway is a hub of innovation, creativity and collaboration, from the cool student life to world-class research to a vibrant startup community with strong IT and medtech expertise, supported by our corporates and public agencies. Many of them are with us here today. I'm also involved with ITAG, who are doing great work in many areas of tech, from learning, skills development, mentoring, training, and much more. So really, you should have a look at the website www.itag.ie to connect. And of course, these events would not happen this week or throughout the year without our fantastic sponsors, as you can see. And of course, to a great working team in ITAG. Today, I'm really excited to be part of this talk, and I have the pleasure of introducing Professor Jane Walsh, Director, mHealth Research Group from the Psychology Department in Galway. Professor Jane Walsh is a health psychologist and director of the Mobile Technology and Health Research Group in NUI Galway, and she leads a program of research on personalised connected health. Jane leads and partners on so many projects worth 15 million euros by Horizon 2020, the HRB and SFI, and many more. Jane is co-leader of the Health and Wellbeing Cluster in the Whitaker Institute and a member of the Irish Cancer Society Advisory Board. She was also appointed the Royal Academy Social Sciences Committee recently and was awarded the NUI Galway President's Award for Research Excellence in 2020 in recognition of her work. So a very busy lady, and I'm so delighted she's taken the time to share her story on the topic of trust and technology terrorism in medicine. This talk will outline psychology's pivotal role in this complex task by providing expertise on user-centered design to guide motivators and show us the barriers to behavioral change. So I'm very excited to welcome Jane. Now over to you, Jane. Thanks very much.
Thanks a million, Fiona, and thank you very much for having me here. I'm really delighted to have the opportunity to present. So I'm just going to bring up my slides and get this talk going. And I'd just like to say a huge thank you to everybody for joining here today. Really pleased and looking forward to your questions. So I'm going to ask the fairly standard question. Are those slides okay there?
Absolutely fine, Jane.
Okay, super. Thank you. So welcome everybody, and thanks again to AtlanTec for delighted to be included in this really fantastic range of speakers. And today I'm going to talk to you from a psychologist perspective, but also looking at the multidisciplinary perspective on the issue of trust and technology terrorism in medicine. Strong words, but you'll see from this presentation why it is that in many cases we feel quite terrorized by some of the advances that are taking place in new technology. And specifically, I'm going to talk to you today about what psychology's role is in this digital transformation of healthcare. So who am I? Well, I think Fiona told you already, I've no secrets left. I'm a professor of psychology in NUI Galway and direct lots of projects in the area of technology and health. Primarily, my work is as a digital health researcher across a range of national and international projects. And I'm going to talk to you about a few of them today, just in terms of highlighting some of the points that we're making. But what do we know already? We know that we are living in the age of a digital revolution. Times have changed rapidly in the last decade. And of course, since the onset of COVID in particular, we've seen a radical uptake in the use of technology. 4 billion people use the internet globally. And if you didn't know already, more people in the world have a mobile phone than actually have a toothbrush. So we know in the last 2 years, it's been quite an eye-opener for the pace of technology development and uptake. But one thing that we're all very aware of is despite the healthcare's efforts to embrace new technologies, especially during COVID, they lag far behind what is happening in the world in terms of innovation and also in terms of the public's own use of technology. What we may all have realized now, even from some of the research on remote working, is that technology can save us time, effort, and money. And in the healthcare setting, it can actually reduce workload, reduce error, and improve patient outcomes. The digital health revolution itself is starting, but it's slow. What has happened is that industry is blazing a trail. It is far outpacing what's happening in the health sector. But through these fantastic innovations we see, it's driving rapid global change. All of the things we've heard of telemedicine, artificial intelligence, electronic health records, they're completely reshaping the way we do medicine. And technology undoubtedly has the capacity to entirely transform the way healthcare is delivered. Now, lots of you here are here because you're interested in technology and so on. And so I'm going to just go through some of the key trends at the moment in technology and health. These are in no particular order, but one of the ones that's quite new and quite noticeable is the rise of on-demand healthcare. Because a lot of the time now we see consumer-led, consumer-driven use of technology, consumer-driven healthcare. And so the sector has responded, but not the public sector, the private sector. So what we see are more and more health professionals setting up a gig economy, freelancing, creating an online marketplace. We see already for our healthcare provider, VHI, that you can, as part of your insurance policy, have access to an online GP. So this is happening here. Big data. We hear this a lot, big data. What is that? Big data is all of the data that can be collected in the cloud from your devices, from sensors that can be used to paint a picture or profile you or anybody else. By using this data through the use of algorithms, we can lower errors in medication. Software can flag inconsistencies. It can see things and patterns before humans can. And by using carefully constructed algorithms, we can identify frequent attenders and we can create preventive plans to reduce attendance. So we can flag things, we can spot patterns, and this is really useful. Virtual reality. Now, virtual reality has actually been around for quite a long time, but more recently, research is showing that, in fact, virtual reality has a place as an alternative to drugs in the case of pain management. And there are many other potential uses of virtual reality that are being explored at the moment. So it's also being used by psychologists for anxiety, for post-traumatic stress disorder, with stroke patients, and then also through all of the lovely visual imagery to motivate people to take exercise. So it seems counterintuitive that you might be sitting with a headset on, but in fact, the idea is motivational. Wearable devices. So you may say, well, hang on, this isn't a trend. They've been around for ages. They absolutely have been around, and they're widely adopted now. There are lots of new devices on the market. We're familiar with the sort of ordinary ones now at this stage, the Apple Watch, the Fitbits. If we were in a room together now, I'd be asking you to put up your hand if you wear any of these devices. I've noticed over the years, the number of hands goes up. It's probably gone now from about 10% to about 50% of people who use some kind of tracking device to monitor their own health. Now, there's all sorts of potential uses for this data, and people don't like the idea always that their data is being used. But what if it were to impact positively on your insurance premiums? And from a health psychologist perspective, you can use the data to monitor and get awareness and insight into your own patterns of behavior, and then use that as a platform for change. So let's take lockdown, for example. I like running. I never thought about something like step count, but my watch told me during lockdown that my step count was extremely low. It wasn't even hitting the sort of standard 10,000 steps a day because we were so sedentary. I probably wouldn't have been aware of it if I hadn't got feedback from my watch. And I think for a lot of us, we're often quite shocked at the level of our sedentary behavior. And this is a bonus. We can use this information to our own advantage. Of course, if we can target some of the things that make us sick and that send us to hospital, then and prevent this, we can have huge economic impact by reducing healthcare costs. And of course, obviously just not getting sick. Artificial intelligence. This is a term that scares most members of the public. If it's real, it's something. If it's artificial, what does that mean? So when we talk about artificial intelligence, we're usually talking about things like chatbots, virtual health assistants. Now, some of us find those a bit annoying when we'd like to speak to a real person. But actually, if they're highly developed and we ask the right questions, sometimes it can be a quick route to solving a problem. But the issue there is around personalization. If we feel we're getting a generic response and perhaps we've got an emotional response to our illness, then this is going to result in high levels of dissatisfaction. So if we can get some sympathetic, personalized responses to our needs through technology, this is something that has a big advantage. This AI market is huge and it's expected to multiply and be $34 billion by 2025. And then finally, social robots. Now you might say, what's a social robot? Android robots. So these are humanoid robots, ones that are friendly looking. Look at that guy there, Dave the robot with his big eyes. So we might think there's no way, we haven't come across robots much yet. There's no way we're going to be dealing with robots. But in fact, the global medical robotic market is projected to multiply and grow 21% just by 2026. Now, this is through many different elements of robotics, not just the robots that might speak to you, also things like your robotic surgeries. But there's no doubt about it that because demand is outpacing availability, robots are actually a very viable solution to address shortages in healthcare. So all of these trends that I've spoken to you about are underpinned or facilitated by the development of 5G. And in fact, now there's talk about 6G technology. So for lots of us, we're like, what's that? But in a nutshell, 5G technology allows 100 times faster responsive technology and connectivity and predicted savings of 650 billion by 2025. With this high-powered technology, we can create virtual environments for robotic surgeries. Now, if you're going under the knife, you might be terrified at the prospect of a robot and not a human doing your surgery. But in fact, there's been huge success already with precision surgery. And obviously there's humans involved, but the robotics are seen as an aid to precision rather than replacing the human surgeon. And there's been some really positive results so far. Augmented reality glasses, a few of us have come across those. But the idea is if you're a first responder on a scene, you pop on your magic glasses, that your data can connect immediately with specialists in India, in America, anywhere around the world, and you can be given on-the-spot advice on how to deal in an emergency situation. So this gives you access to people remotely at speed. And this is a huge breakthrough in on-the-spot healthcare delivery. And then, of course, remote monitoring. Now, that word monitoring, it has negative connotations, but the idea that clinicians can jump in without having to get in their car, collect data, make fast, reliable diagnosis, assisted by technology, is a very positive development. Now, one thing that's driving all of these changes and developments, of course, is industry. And as Fiona says, in Ireland, we have an incredible tech industry. We're really punching above our weight as small nations go. Internationally, there's been huge developments in health technology. And some of the trends I've spoken to about sort of illustrate these to you. But let's get real here. If you're a technologist or you're an industry or you're a researcher, you probably find all of that very exciting. But if you're an ordinary member of the public and you see what's happening now in the news about Facebook, data privacy breaches, there's a huge growing unease. And I think at this point, public distrust around technology and privacy has never been higher. What do we know? Well, this is what we all know, that as we move, we leave a digital footprint. All of our devices are wearables. You know, they're not federated data. Our data is going into the cloud. People have access to it. Some people are very, very interested in what we do, more interested than ourselves. We now know from algorithms, and some of us like to try to foil them by putting in the wrong age and gender, but it's hard when you use multiple devices to not have a very good picture of yourself available widely. This data is being used back to advertise, market, and sell to us, and it's increasingly relentless and it's very tiresome. We're now a bit sick of all of the horror stories we hear about, being monitored, controlled, that we're just a brick in the wall, and there's a bit of a backlash now towards technology. Even though with the pandemic, we became very reliant on it, people are a little more fearful of new developments, particularly where their health is concerned. The public aren't the only ones who are worried. Healthcare workers are going, hang on a second, robots? Does this mean I'm going to be out of a job? So when you do analytics on what healthcare workers do, data shows that almost a third of a nurse's time is wasted on low-skilled tasks. These are highly trained workforce. If you have a robot doing some more mundane tasks, this frees you up to engage in skilled, complex work of treating patients. And for healthcare workers, this is why they trained. Of course, we know that even though we like to think the pandemic's over, that COVID is still around us and causing problems, and robots can't get it. But patients are also concerned. Yes, there's a problem with access. Demand is outpacing availability of staff, but I don't want to see a robot. Does this mean I'm not going to see my doctor? Because I can speak privately to them about my fears and concerns and not endure the cold stare of an emotionless robot. So how do we deal with all of these conundrums, the fast pace of industry, patients' concerns, breaches of data privacy, all the new GDPR? How do we navigate this? How do we harness technology for the health and well-being of all? Well, the World Health Organization developed a digital health strategy, and they have said clearly that the vision of the global strategy is to improve health for everyone, everywhere, by accelerating the development and adoption of appropriate, accessible, person-centric solutions. Person-centric solutions. That's the important bit. So it's not just done by a computer scientist or engineer in a lab. From the very beginning, the person is at the center of design. They've gone further. In their mobile technology adoption guidelines, they said we want stakeholder involvement. So yes, the person, the patient, but not just them, the nurses, the doctors, the physios, the team, the porter, the engineers, everyone who's involved in the care of patients. And once you start thinking about those, there's a lot of players. So what do we need if we want a safe and effective digital transformation of healthcare? Well, we need a multidisciplinary approach. So you'll say to yourself, oh, that word is overused. What does it really mean? Well, it means meaningful engagement with stakeholders. Now, if you think about what I've just described for digital healthcare, and if you ask the question, well, who is the expert on this topic? Who is the expert in digital health? You'll realize when you start thinking about it that there's no one discipline. It's impossible. Somebody might say, oh, it's the computer scientists, it's the engineers. They don't know anything about patients or medicine. They don't know anything about the healthcare system. Oh, some of them do, but it's not their area of expertise. So you need to put together the team that can help you take a very long view of the challenges, the barriers, and the problem-solving approaches to developing this. And also, you wouldn't think immediately, but psychological expertise is really important, and I'm going to explain to you why. If you think about all of the facets of a patient-centered design that are required for the digital transformation of health, you need to know, firstly, is this acceptable to patients? Is this technology acceptable? If you're thinking, I'd like them to wear this device around their neck, on their head, in their glasses, on their wrist, you've got to see whether or not patients will go for this, because you've lost it at the first hurdle if they're not willing to wear or engage with the technology. And then engagement. So all of us here, we've got apps on our phones, apps for step count, apps for our diet, our 5 a day, everything. But for how long do we use them? And do we really engage with them in the way we're supposed to? And what about the design? How many times have you looked at an app or a device and thought, I don't like the color, the writing's too small, there's too many screens. And all of these things affect efficacy. And efficacy, what does that mean? That means that the technology works in the way it's supposed to work, that the response of the patient is exactly the desired response. And one of the key things that doctors need patients to do is to change their behaviors or engage in certain types of behaviors that will keep them well, that will keep them happy, that will keep them out of hospital. Now, we just think about what we've been through, and I know we all want to forget it. But when we reflect on it, we realize that technology was critical in combating the pandemic. And we also got so many public health messages about what to do. Behavior, behavior, behavior. Wear a mask, get your shots, wash your hands, stand 2 meters apart. These are behaviors. These are actions. And we need to be given specific guidance on how to do them, where to do them, when to do them. And then we need to understand people's motivation for engaging in the behaviors. So you'll have heard some of your friends say, there's no way I'm getting that vaccine. There's no way. That's a behavior that some people chose not to engage in. Masks. This is something that's going to go on for quite a while. Why would we wear one? When do I think it's not acceptable to wear one? So there's a huge amount of psychology in people's behavior, and people's behavior is key for their health. So this is where we come in. Now, this quote really kind of sums up the problem. There comes a point where we need to stop just pulling people out of the river. Some of us need to go upstream and find out why they are falling in. Why? Why are you not keeping your New Year's resolutions? Why are you not getting the vaccine? Why won't you wear a mask? If we understand people's concerns, the barriers to behavior, and we harness and engage with the facilitators to behavior, people are more likely to take their medicine, exercise, eat healthy, if we understand the whys. And this quote says that if you don't engage with your people from the beginning, you will not succeed. So think about buttoning up your coat. Now, we all know this guy. We are this guy. On the one hand, we're out there jogging in Lycra, but then on a Saturday night, we're drinking a bottle of wine. Humans are complicated. It's not all or nothing. And we need to know sometimes where people's fine lines are and what they're prepared to do. We need to understand their psychology. But I've noticed in working in multidisciplinary teams, I use different words to other people. So for example, I use the word behavior, and computer scientist goes, I don't understand what a behavior is. We use the word activity. And I think, okay, so let's find our common language. So some of the research we've done is looking at things that seem very obvious, like using an app for medication adherence. How many of us have to take some kind of pill where we forget, and we say, I'm going to take that with my dinner, but then you're somewhere else for dinner and you forget. So would a buzz on your app help you remember? Well, what we discovered when we talk with patients about technology, what they want from their apps or other devices, are they want something that's not generic. They need it personalized for them. They want to know that the app or device has been prescribed from a trusted source. So not just, through some social media suggestion, not just a click on the link, not just some person they don't know or like suggesting it to them, but from a trusted source. And this is really important. So if you want patients to engage, you need to bring them on board. Their doctor, their nurse needs to have a chat with them about what they're looking for and how they could potentially use this technology. You need to understand patients' motivations. If you want a patient to quit smoking, you need to ask them, do you want to quit smoking? Trust me, if they say no, leave them. If they say maybe, then you start from, well, what would be the things that would encourage you or otherwise? So we need to understand what they're going to do and not. The simple questions will give you that. And communication. If patients think you're trying to replace your face-to-face, they won't be interested. If they think that you're going to facilitate your communication by adding some technology into the mix, they will find this appealing. So the European Commission has recognized that behavior change is key to health and well-being. If people are eating bad diets, you need to start eating some fruit and veg. That's a change in their behavior. If people are very sedentary, they're not taking any exercise, maybe they're overweight now, or their digestion isn't very good, then that's behavior change. And we need to find ways that are going to be effective in achieving this. Now, I mentioned apps on the mobile technology. And again, I'd love to be in a room with you all. I'd ask you for a show of hands, how many of you use apps, to get fit? There's a couple of them there. Look at that, the 7-minute workout. And we all think, fantastic. 7 minutes for buns of steel. I'm sold. But when you look at the data on whether or not these apps actually work, the answer is most of them do not. Why don't they work? I'm going to go back to what I said before. If you don't understand human psychology, you're doomed to failure with your health technology. So I'm going to give you a tiny bit of the science bit for an illustration, because behavioral science is a science tried and tested through all of the standard scientific methods. There's a full science of health behavior change. So if there's anyone here who's developing health technology that wants to dive into this further, please do get in touch with me. I work on lots of these kind of projects and I'm always interested to hear about your innovations. We understand the person at the center. What's their motivations? Do they have the capability? Do they have the opportunity? And then more widely, as we go through society, well, what are the legal implications? And, are there regulations and so on? We also know that behavior is complex. And 3 key things that affect us, and just reflect on this for yourselves here today. Do we have the opportunity to engage in it? For example, if you say to somebody after work, you need to go out for a walk, and they say, well, look, I live in a country road, it's not lit, there's no path. This is actually an opportunity issue. The nearest gym is a 20-minute drive, it's a bit far away. Do they have the capability? Well, actually, I'm in a wheelchair, or I've got sight issues, so I can't do that. So what are the alternatives? And do they have the motivation? I really don't like, exercise. I don't like sweating. I'm not really interested in doing that. So maybe you think, well, okay, maybe there's a different behavior that might be more appealing. But the key is partnership. So from the very beginning, you need to understand, what is the need for this technology? What is it trying to achieve? Are you very clear on that? Is the one that you're developing, is that best placed to solve this problem? Or is there better technology on the market? And ask it another way, is what you're developing potentially able to service another need that you didn't anticipate? How are you going to test and trial it? And how are you going to apply best practice and science? Get your stakeholders involved and do a full evaluation. And all of this is done through partnership. Another study we did a couple of years back was looking at leveraging mobile technology with cancer survivors, specifically cancer survivors who were living with obesity, because their risk of reoccurrence of cancer was greatly increased. So the focus of this project was to get them moving more, and we call this the Moving On project. So what we did was we used mobile devices, Fitbits namely, to create personalized goal setting. And we communicated weekly with these cancer survivors. We gave them a Fitbit, and then we tracked them, and we said, okay, look, Mary, you do 2,000 steps a week or a day. We're going to move your goal up a little bit for next week. You've got a device that will help you monitor how you're doing and try to hit your target. And we're going to give you feedback on how you're doing, and we may set you a new goal. So this was our strategy. There was communication through text message and phone calls, but they went away with their piece of technology. And the standard group got standard care. So we actually tracked them with a Fitbit also, just to see what they were doing. But they were given generic advice. You know, it wasn't targeted psychological goal setting advice. It wasn't personalized. It was generic. What did we find? We found that our people who got the personalized advice, personalized goal setting, they started moving more. They knew what they were supposed to be doing. They got fitter. They also had a lower BMI, so they lost weight, which was fantastic. But more than that, when we asked them what they thought, they loved the project. They loved the communication. They loved the advice that was specific to them, and they liked using the technology. And a lot of them felt that they'd come on a journey through discovering how to get a little bit fitter, and it's something that they would retain in the longer term. Now, another thing that we do in our work is we engage with industry, because scary and all as industry can be to lots of academics, in this area, engaging with industry is key. So one of the companies we worked with, maybe known to some of you, Symphysius Medical, they have really made some huge strides from startup just a few years ago to where they are now, securing huge money from Enterprise Ireland and winning numerous awards. Years ago with an idea, and the idea was a management of fluid in the lung in cancer patients living with terminal cancer who wanted to stay at home as long as possible. So they spoke to cancer patients, their carers, doctors, lots of different people, and we worked with them on this stakeholder engagement. And from there, they recognized the value of such a device, allowing people to drain fluid at home with feedback through an app, but to develop a device that was acceptable and appealing to patients and their caregivers. So they've been doing fantastically well. But they, from the very beginning, approached this delicate area very thoughtfully by talking to everyone involved in the management and care of these patients. And then what about robots? So you might think, oh, well, you know, this is Galway. We're not going to see these anytime soon. But as I've said already, you know, if you go into Galway Hospital now, and of course anywhere around this country, you're going to probably be in A&E for a long time, and you may not be seen by anybody immediately or seen between visits for a long time. So given this new development and how they can help us, here's just a few ways that robots are sneaking into hospitals already. So there's a robot called Moxie, not in Ireland yet. And this robot finds lightweight objects, can be given instructions, carries sacks around the place, has got the capacity to navigate clinics' hallways better than most of us, I'd say, visiting, and drop and collect things for nurses. In Galway, I've actually been involved in a couple of studies led by Professor Derek O'Keefe here in the hospital, where robots were used in the foyer of University College Hospital Galway to give people a nudge as they arrived in to remind them to clean their hands. And as we know, the superbugs in the hospital are a real problem, and during COVID especially. So Dave the robot could sense when someone walked into the foyer and would politely ask them, would they consider washing their hands, and sort of, you know, there's a hygiene station right beside him. If people said no, Dave the robot put a sad face on. If they said yes, He responded and said, "That's great, you can wash your hands here," and so on. And what we found, in fact, was that Dave, the robot, through an observational study, significantly increased hand hygiene behaviour by 1/3. So 1/3 more people washed their hands when Dave was present. Some other studies have found, say, with older adults at home who could get a bit lonely, and loneliness is a major trigger for depression in older people. So many of you, we may know, our parents or grandparents have got Alexa and talk to Alexa during the day. So these robots have been surprisingly well received, not just in a bit of chat, daily activities, maybe access to the news, but also to deliver cognitive stimulation games. And for patients maybe with early onset dementia and so on, this has been shown to have some really positive effects. So research has shown that while there's good companionship from these robots, they need greater personalization. So in the design or modification of them, we work with the patients to sort of hone their social robot to suit them better. And this is the future, co-design. Now you might say, well, what about the doctor's job? Because those other things, they're a little bit lighter touch, aren't they? What about the idea of motivational interviewing? So imagine meeting this lad and you're coming in perhaps with diabetes and you're thinking, no, I really need to see the doctor. So a trial was done using a social robot to deliver a motivational intervention. And believe it or not, the robot successfully reduced high-calorie snacking and reduced weight by 4.4 kgs. This is one study just in 2 weeks. I mean, if any of us thought that would work for us, we'd be right there with that robot, especially post-COVID. And not only that, but it increased the perceived confidence of patients. Now that seems unbelievable, but that's what this research showed. And when you compare it to the clinician, it was just as effective. So maybe the doctors do have a little something to be worried about, and perhaps the patients have less to be worried about. We actually used Dave the robot also at the diabetes clinic here in NUI Galway, or in the University College Hospital. So there's Derek O'Keefe on the right, with well-known to you all now, Luke O'Neill in Dublin, where it was featured on the news, not this week, but recently, talking about how Dave has been effective in the diabetes clinic. So our research has shown, and it's now published actually, just recently, that through collaboration through many disciplines and the patients using a PPI panel, we developed educational videos and an interactive quiz that was delivered by the robot in the waiting room to patients. In short, patients actually liked the robot. So anyone who's sort of thinking, no, they'll never go for that, they actually enjoyed the interaction with the robot. And we found it significantly increased their knowledge compared to those who did not interact in the waiting room. So again, this study is published if you want to read it in full. So some really positive results, not just over in America. Here in Galway, there's some really interesting research using some of these newer technologies. So that's a lot for you all to take in. And I've been talking for a long time, so I'm going to sum up now. What is the future of health technology? Well, if we're going to plan forward, we need to really think about engaging our stakeholders. And how do we do that effectively? Is it through a collective intelligence, focus groups? How do we harness all of this expertise? And we need to use a mixture of qualitative and quantitative methods and very sophisticated trial design to see what works best for who, when, in what situation. We need to be really up on our safety and privacy concerns and adhere to the regulations, whilst also driving innovation forward. And then we need synergy between disciplines, with the person at the centre of design. And one of the things to overcome here is people's fear of having to deal with experts they've never had to deal with before. I can tell you, as a psychologist, I got a lot of skeptical looks from computer scientists and engineers going, oh no, what have we to talk to her for? But as time has gone on, we have found a common language, we've shared a common goal, and we are moving forward to develop effective technologies. We need to take the view of quadruple helix approach. So we need to be aware that the government have a job to do, academia has a job to do, industry is driving innovation, and there's the citizens. So always we think about engaging partners across all domains. And we really need, for academics especially, to engage with industry. And I have found that industry are really keen to engage with us. So there's fantastic potential for fantastic collaborations. So in short, by following this idea of quadruple helix approach and taking the plunge and engaging across disciplines with patient at center of design, I think a safe, effective digital transformation of healthcare is definitely achievable. Teamwork makes the dream work. Thank you very much for your attention.
Well, Jane, I tell you, that was so interesting, and your positivity is infectious. So it makes me want to hear more and more about this area. And I really liked, some of the messages you gave us, the key messages today, like the trends. I'm sure most of the organizations here are working on some of those trends. And if not, I hope they put them in their future plans. I thought it was interesting, public distrust. We need to use a person-centric user design, and that's the way forward. The big question to keep asking ourselves is why? And again, finding a common language. Another key message I thought for us all is human behaviour is essential for technology development in healthcare. So I think lots of very, very good messages there before we get on to some questions. And yes, I did meet Moxie in UCHG over COVID, and it was very interesting. And I'm sure with all of us here today, if you were a salesperson selling one of these robots, I'd say you'd have a lot of POs by the end of this session, because we'd all be buying, especially I'd love one at home. So it would be brilliant. So let's get on to some questions, folks. And we have some coming in already, and I also have some myself. Let's go. Do you have a sense of how long it might take for such robotic initiatives to achieve ambiguity?
To achieve ambiguity? I find that question ambiguous.
Well, let's go on to the next one. So I suppose in your projects, Jane, you work with a lot of different groups between healthcare, psychology, computer scientists, and marrying these different groups with different skill sets. I'm sure it can be a challenge. Same as any organization projects as well. So have you any tips for organizations on how to make these teams marry better?
Yeah, it's a really good question. And certainly the approach I've always taken, and I would have seen myself as someone injecting myself from the outside, often unwanted, into these already high performing technology teams, is that you go in there with the view of how can I help address the problem? If you think about the way Horizon has structured its funding calls, it's societal challenges. So again, it's the idea of teamwork. There's no one ego or one discipline that's dominant here. Every discipline needs everyone else. And at the center of it really is to improve health and well-being. So sometimes we need, to focus on what are we trying to do? Is this the best way to do it? We're all here to help. And really, if you take that approach in a team, you can make yourself quite invaluable to that team. And I think as well, say as a social scientist, so this is advice I'd give generally to social science, you need to understand your value. It's not always immediate to you. So when I outline the bullet points for psychology, you need to explain to people that for behavior change, you need to understand the whys, as you said, and the hows. And if your science is expert in that now, you can help them design a tool that will tackle the whys and the hows and bring about the desired result. And if industry engages with academia, they can also get some really good Q mark publications that will help their product in terms of quality assurance. They have tried through pilot trials or other trials or stakeholder qualitative research to see people like it, they use it, it works. This is invaluable if you're trying to market and sell a new innovation or product. So I think taking a problem-solving team approach, trying to sort of recognize in simple terms, what are we trying to solve? Make sure everyone understands and is on board, and then try to move forward from there. And another really important tip I would say is not to be afraid, especially academics, for brainstorming. So you have to be okay with sounding a bit stupid sometimes. What about this? What about that? Oh no, that wouldn't work. What about this? Because it's really through that kind of joint multidisciplinary brainstorming that you can get some brilliant ideas going and start to narrow down your problem solving approach. So they'd be some of my tips.
Brilliant. Absolutely. Completely agree. I'll go on to the next few questions. What level does technology robots need to be at to fully replace human physician or GP? Will it need to look, walk, talk like a human, or will people accept less if the tech works?
Oh, that's a really good question. The very short answer is I actually don't know how attractive the robot has to be before people start running away from it. I imagine it was a sort of Darth Vader-y thing. Some people might be a bit scared. So Dave, the robot I showed you with the big eyes, he's a really kind of pretty robot. And then you will have seen some people develop robots that are rabbits or dogs, you know, and they are really well received as well. So I think the key is that the more humanoid the robot, the more like a human, the more acceptable it is. And given the transition phase of where we're at, if it's too wildly different from your doctor, people may react negatively. So in the interim, certainly, I think ones that are a bit more human-like, that have a voice that's quite nice, perhaps the accent is sort of going to be one that's friendlier or more acceptable. And, you know, these are things we test and research, male or female voice, which would people prefer. But that the actual correspondence is personalized to the individual, and that the responses make sense and that they appear to address the question or concern of the patient. I think if this happens, they will become more mainstream more quickly.
Super. I look forward to it. Another question in, Jane, and we might have to give up after that because we're running out of time. Is the regulatory environment keeping pace with these medical innovations? And if not, is the regulatory environment a barrier to innovation? Wow.
Yeah, very good question. Certainly with GDPR, that threw a huge spanner in the work for a lot of the work that was being done for a lot of technologists. I think the regulatory body is essential because there were a lot of cowboys developing things that could potentially harm patients. I think if people are developing bona fide, good quality devices and so on, yes, it's quite painful to go through the regulatory process, but it's there to protect patients, and ultimately it's a huge Q mark for your product as well. So yes, it is slowing down innovation, but you know, as we said, I use the term outpacing, you know, the real world, which is great, but there needs to be stops and checks. Just think about the development of the vaccine, think about the development of medicines. I think technology has to go through that same careful path of trials to prove that it won't cause harm, and I think therefore it's important.
Brilliant. So I think another key message is, you know, it's collaboration, it's engagement with your stakeholders, it's getting everybody involved. And as you say, COVID showed a real example of how working together, things get done. Sometimes maybe a little bit in chaotic ways, but working together, it definitely works. So Jane, a huge thank you from all in AtlanTec for joining us today on a real topical subject. For you, the audience, for the questions, for bearing with us all week long, and we'd like you to tune in for the rest of the day as well. We have a great lineup of speakers by registering on www.atlantec.ie. We've some more from NUIG, Owen Clifford, Rory Monaghan, and some other great speakers like Gareth Hines and many more today. So please tune in. Thank you to everybody. And I think we'll leave it at that. And thanks again, Jane. Best of luck, everybody. Have a nice day. Bye.
Thanks a million.
Take care. Bye.